All right, good afternoon. It's always hard to follow someone who has a fabulous accent, but I will do my best. Good job, Dan. First of all, thank you for having me today. I want to thank Dr. Stevens for asking me to be part of this great meeting. It's such an honor to be here. It's also really an honor to be able to represent a brand that I truly believe has changed the way that professional dispense skincare is perceived. Alastin was first brought to market in 2015, and I can't take any credit for that because I joined in 2020, but I'll say that our founders actually had the foresight to recognize that there was a gap in the professional space market. They recognized a gap as minimally invasive procedures were increasing and on the rise at double-digit numbers. No skincare brand had really recognized that there was an opportunity to partner with procedures to actually improve outcomes and to help drive faster down or deliver faster downtime as well. My slides have a mind of their own, apparently. The timeline of Alastin has been very exciting since 2015. As we move through the years, we brought not only procedure products to market, but also body products. And I'll talk a little bit more about the science behind those in just a moment. But a huge event for us, as all of you probably know by now, is at the end of 2021, Alastin was acquired by Galderma. And that has provided an additional opportunity now with the backing and with the support of a company that is the integrated leader in dermatology to be able to bring more resources, more increased services, better education, as well as just a more overall holistic offering for our healthcare accounts as part of Galderma. So we love to talk about the science, and that is really what put Alastin on the map. We heard a lot in a great, interesting session earlier today about regenerative products, sort of the wild, wild west, a lot of big unknowns, what's gonna happen there. And we're very proud of the fact that we do know what's gonna happen with our products when it comes to procedure pairing. We have the science and we have the backing. Every single product that we develop at Alastin goes through a 3-step process in development. We start with gene expression, and if anyone doesn't know Dr. Alan Widgerow, I highly recommend meeting him. He is absolutely brilliant, but is known, world-renowned in wound healing. And so when you think about procedures, the way to go about treating skincare with procedures is to make sure you're thinking about how do you heal the skin after a severe wound. So we start with gene expression in the lab to see how ingredients interact with each other, where the synergies exist. Move on to histology with biopsies there to see what's actually happening in the skin. And then, of course, then go into clinical studies with our physician partners to see what actually happens in practicality. We are also published again and again and again. In fact, since last week when I submitted these slides, we had our 41st publication, and then just this morning we found out that our 42nd publication is coming now as well. So everything we do is backed by science, and I think it's gonna be very hard to find another skincare company that can show this level of published evidence in peer-reviewed clinical journals. So what is the science? Trihex technology is the foundation of the Alastin scientific platform. Now, if I'm describing what this is to my family, who knows nothing about the science behind it, I talk about it in a gardening analogy. If you're going to go and you're going to do any gardening, which for the record, I don't, but if you were going to, you would want to clean out the weeds first. So that's the first part of our proprietary skincare mix with our peptides and our active ingredients, is to make sure that we're getting in there and getting rid of kind of the waste products. Those products, the fragmented elastin and collagen that have been gelatinized over time and are essentially just taking up space in the soil, right, of the extracellular matrix. So the first thing we want to do is move that out of the system. Then with our hexapeptide 12 patented peptide, we want to come in and begin to stimulate the fibroblasts to produce more collagen and elastin. And then that will continue this regeneration process of cleaning out the old and regenerating the new. And that's essentially what Trihex is. And we have this as a base in a great deal of our products, specifically our procedure products. And the proof is in the pudding, the proof is in the photos, right? So here you'll see across just 4 of our products, the actual pictures of what's happening with both collagen and elastin. Up top, you see the collagen difference, sometimes at 2 weeks, some 12 weeks, but in all of these, you see a significant difference in the neocollagenesis, but at the bottom, you actually see a difference in the elastogen as well. So we're able to show both of those in histology. Now, where Alastin first really built its name, I figured in my very short time that I have up here, I wanted to focus just quickly on 2 of our products. The first, and the one that put us on the map, is regenerating skin nectar. This is an incredibly exciting product. If you haven't felt it, you have to feel it. It feels like silk, but it is proven again and again and again. We have so many studies with this. It was our first product, how we actually help to enhance outcomes and reduce the downtime for patients, which you know is critically important. We have a number of studies here, but this was the first. This was with Dr. Sabrina Fabi, looking at very ablative CO2 procedures, right? So we knew if you're gonna actually show a result in a super ablative procedure, you really have something special here. Note that our product too, Skin Nectar, is non-aqueous, so there's no water, there's no preservative, so it can actually go on freshly ablated skin. And I think nothing speaks, more clearly than the actual photos. And what you see in the pictures here is on the top row, you can see patients who, it's two different patients who have gone through the process of a procedure, of an ablative procedure. By day 4, by day 7, they still have a lot of the downtime left, right? They still have a lot of the results to work through, whereas the actual nectar patient has recovered much quicker. I also wanted to talk briefly about Transform, because we were able to show these great procedure results with nectar in laser treatments, but then we came out with a body product, which is Body Transform, and again, have numerous published studies. At the time, cryolipolysis was the gold standard in body sculpting procedures, and so Alan and our phenomenal formulator, John Garudo, created a product that actually has a unique patented lipodrome delivery system to bring hexapeptide down through the hair follicle so that it gets into the dermal fat layer. And once there, it's able to stimulate the autophagy process to help move the dead fat cells out of the body faster. And what we've been able to see with this is actual reduction or a speed up of the results. You can accelerate the results of these body sculpting procedures by using Alastin a couple times a day post the procedure. We see it in the arms, we've seen it in the belly, you can see it here with an M-Sculpt procedure as well, but we're able to show a very significant volume reduction in the side that's treated with Transform at a much faster time frame than the other side. So these are just two examples of our product line, but we're proud that with every product we bring to market, we go through the same rigorous scientific process. And I'm just in time here with 30 seconds. I did want to close with just saying, as part of the Galderma family now, we are able to provide, like I said, a much more holistic offering. Even when it comes to our loyalty programs like Aspire, now we can offer benefits to patients and to physicians with their purchases through the GAIN education platform, and then just in general being a better service provider overall. So thank you very much.